Ever wonder what your heart is doing all day? It's a busy little organ. Think of your heart as your body's own personal delivery service. It works non-stop, pumping blood on a superhighway of arteries and veins. This blood carries oxygen and nutrients to every corner of your body, like tiny little packages. This delivery service is super important, and it's why having a healthy heart is so vital. Now imagine if part of that delivery service wasn't working quite right. That's what happens with a condition called hypoplastic left heart syndrome, or HLHS for short. HLHS is a rare heart defect that babies are born with. It means the left side of the heart, which is like the main pumping station, didn't develop properly. It's like having a tiny pump trying to do a big job. Because of this, babies with HLHS need a little extra help. Thankfully, doctors have developed amazing surgical procedures to help these little hearts. These surgeries help redirect the blood flow and make sure the body gets the oxygen it needs. It's important to remember that while HLHS is a serious condition, with the right medical care, babies born with it can grow up to live full and active lives. Doctors are like detectives, always on the lookout for clues. They use amazing tools to check on babies even before they are born. One of these tools is an ultrasound, which is like taking a picture of the baby's heart while it's still inside mommy's tummy. After a baby is born, doctors listen closely to their heart with a stethoscope. They also look for other signs like bluish skin, difficulty breathing, or problems feeding. If they suspect HLHS, they'll order a special test called an echocardiogram. This test uses sound waves to create a moving picture of the heart, showing doctors exactly how it's working. Early diagnosis is key. The sooner HLHS is detected, the sooner doctors can start treatment and give these little fighters the best possible chance. Section 4. HLHS by the numbers. How common is it? HLHS is considered a rare heart defect. It affects about 1 in every 4,000 babies born each year. That means if you are in a school with 4,000 kids, there might be one student with HLHS. Interestingly, HLHS is a bit more common in boys than girls. Scientists are still trying to figure out exactly why that is. It's one of those fascinating mysteries of the human body. Despite its rarity, HLHS is the most common single ventricle defect. This means it affects the way the heart's chambers or rooms are formed. Section 5. The future is bright. While HLHS presents challenges, there's always hope. Medical advancements are happening all the time, leading to better treatments and brighter futures for children born with this condition. Remember those amazing doctors we talked about? They're constantly researching new ways to improve heart surgeries and care for HLHS patients. With ongoing research, improved surgical techniques, and dedicated medical teams, children with HLHS have every reason to look forward to a future filled with possibilities. Subscribe.